What is up, y'all? Today we got this, today's lecture is on the mediastinum, so that's what we're going to be looking at. The mediastinum is this region in our thoracic cavity that lies between the lungs and pleura. And, you have your lungs on these two sides, and then in the middle you have this mediastinum. So, what is this and what can be found in it? So basically, we can separate mediastinum into a superior and inferior portion. In the inferior portion, we separate into an anterior, middle, and posterior portion, depending on what we find in those regions. For the superior mediastinum, it's kind of bounded by the superior thoracic aperture, and then goes down to T4-5, which is at the transverse thoracic plane or sternal angle. And the inferior is going from the T4, T5 or sternal angle down to the diaphragm. And that's how it's bounded. Now, what are we finding in these spaces? So the superior mediastinum, we're gonna find great vessels. The superior vena cava is one of those. The thymus, the left recurrent laryngeal nerve, the esophagus, the trachea, and the thoracic duct and lymphatic trunk. So that's what we'll be finding in the superior mediastinum. Now let's look, if we go anterior to posterior, what are these structures we'll find in that order? So if we go anterior to posterior, we're gonna first find our thymus. Remember I said the thymus is in there, it's right behind the sternum. Posterior to that is our veins, right? So here's like a left brachiocephalic vein. Posterior to the vein, you're gonna find the arteries. So here's our arch of aorta, brachiocephalic trunk. We're gonna have our pulmonary artery. Behind the arteries, we'll find the airway. So our trachea, which is right here. And then behind that, we'll find the esophagus, which is right here. And then behind the esophagus, we will find the lymph. So the thoracic duct, lymphatic trunk. So again, we have thymus, vein, artery, okay, and then trachea, esophagus, lymph. Now, I also mentioned the left recurrent laryngeal nerve. This is right here. There's also a phrenic nerve, and there's also a right vagus nerve. So those nerves are kind of scattered around, so we're not really gonna say where they are in relation to these other structures. But that's some big structures we'll find from anterior to posterior. Now, let's talk about the inferior, okay? So we'll divide this into an anterior portion. This will have our adipose tissue, right? It will have lymph, it will have the internal thoracic artery, and it will have the thymus in children. The middle mediastinum is going to have our heart and pericardium. Then our posterior mediastinum, this is going to have our thoracic aorta. We can see this thoracic aorta, and that's also in the superior, well, aortic arch really, but descending thoracic aorta. In the posterior mediastinum, we have the thoracic duct, azygos, hemizygos veins, esophagus again, and esophageal nerve plexus. Now, if we had a question where you had like a patient with a hypertrophic right atrium, right? It's gonna be in the heart region, and it's pushing back on a structure, and what's that structure, and then what structure is behind that structure? We know the right atrium, it's going to sit just anterior to the esophagus. So if it was enlarged, it could press on the esophagus. And behind the esophagus, we'll find these structures, right? Azygos, and we'll find, azygos, hemizygos veins, thoracic aorta, and the thoracic duct. That would be the correct choice there of structure. So I'm sure they have a picture somewhere of that. Anyways. But yeah, if we wanted to know the structures behind our right atrium, we'll just look at the structures in the posterior portion here, and that is what we're gonna have. So all right, y'all, we out.